Three, two, one. I am live. Hi, folks. This is Dr. Magarelli, CNY Fertility. And today I'm going to be talking about P plus P equals P, which is patience plus perseverance equals pregnancy. So I'm just going to tell our wonderful folks over on the Instagram, guys, jump over to Facebook Live. Emily, thank you. Queen Swift, jump over to Facebook Live. Jesus, Johnny, jump over to Facebook Live. Hey, Tasha, thank you for saying hi, so I know where you are. Everybody, jump on Facebook Live, our YouTube channel, CNY Fertility. Unfortunately, Instagram doesn't let me show you these great presentations, so Tasha Weenu, jump over to Facebook Live. Kara1513, jump over to Facebook Live. Sorry, folks, on the Facebook Live. Hi, Joyce. Hi, Atisha. Hi, Reiki. Hey, Tasha. Hey, Lisa from Fort Collins. You betcha. Hey, Lainey. Hello. Nurse Diplock. Jump over to Facebook Live. Constant07. Bird Bash. Jump over to Facebook Live because I'm doing a presentation on patience plus perseverance equals pregnancy. We're going to be talking about time. Everybody wants to know about time. So jump over to Facebook Live, Mrs. Martell, Karen, jump over to Facebook Live, Bird Bash, jump over to Facebook Live. Okay, everybody's jumping. Good. Let's see. We got all kinds of wonderful. Antoinette. Hello, Alex. Hey, from I'm assuming that's Maryland, or hey from a doctor, could be one. Melissa Jazir. Hi there. Okay, everybody, Selena, jump over to Facebook Live. Nurse Diplock, jump over to Facebook Live. A. Jones, jump over to Facebook Live. I'm doing my talk over here. That's all I'm talking about is jump over to Facebook Live. So I'm going to get started. Guys on Instagram, I'll try to tell you I'll read what I say, but the best thing is Facebook Live is where the presentation or YouTube, our YouTube channel, that's where all these talks are going to be from CNY. Instagram does not let us do what we need to do so I can show you a presentation. Now it says in the corner in the top here, New York surrogacy. I apologize, I didn't know how to take that off. But just follow my size. Hello, Sha, Maddie, Georgie, Maddie, Georgie, Amanda, hello. Excited for the second round. Good attitude. Alex Gray, yeah, from Maryland. I'm a goofy guy sometimes. Okay, so let me come over here. Let me go backwards here. Let me get the pointer option, nice little laser. Let me first go previous. Okay, let's go to the pointer. Let's go to laser. Now you can see me. Well, folks, here's the good news. We're going to be talking about time. Now, I want you to understand one concept. The person in front of us as physicians, the person in front of us has either a 0 chance of pregnancy or 100% chance of pregnancy. 0 or 100. There's nobody who has a 3% chance of getting pregnant. You are either pregnant or not. So what I really want you to do, now this is a challenge, this talk, because it talks about time of which we have no control. This will be about 20 minutes, and then I'll answer all your questions that you throw at me. Anyone on Instagram, jump over to Facebook Live. You'll really enjoy the presentation, so jump to Facebook Live or to your YouTube channel. The Lady Toy, Allison Harjit 79, jump over to Facebook Live. Okay, so patience plus perseverance equals pregnancy. So this is your probability based on your age of achieving a pregnancy in nature. So within a year, an 18-year-old will have about an 88% chance of achieving a pregnancy. By 25, that chance is approximately 80%. By 30, as you can see, the chance is about 65%. By 35, that chance is about 55%. By 40, you see that chance is about 38%. And then all of a sudden, around 44, 45, the chance goes down to essentially 0. So this is our biology. It's not pathology. It's not wrong. It's not bad. It's just our biology. So we in the field of reproductive medicine, we always look at the age of the female, by the way. This is female. Because time tells us a story about conception. So this person, if they try for 1 year, they have a very good chance of achieving a pregnancy. This person, it may take them 5 years or 10 years to achieve a pregnancy, but of course they may run out of time. But the point of it is persistence and perseverance. The person in front of us may get pregnant, but we have to understand what we're dealing with in nature. So this is nature. You're not going to change it with herbs or yoga or protocols or medications. Well, that's not true. Medications, of course, can change this. This is the probability that sex is going to do the job. Okay. So why is that? Well, the reason for that is a very simple understanding. This has been known for many, many years, is how many eggs a woman has depends on where they are in their life cycle. So Eden, Ben Dodo Way, Meg Marnell, jump over to Facebook Live. You'll see what I'm talking about here. And so you see here that at birth, before birth, so birth is 0 here, you have about 7 million eggs available to you. But by the time you're born, you're down to about 2 or 3 million eggs. And then from birth to 13, you begin to lose eggs. We call it saying follicles, but they actually counted the eggs. And they talk about the optimal fertility being between 18 and about 31. Then there's a decline in fertility between 31 and about 40, significant at 35. And then, of course, at 41, there's a severe decline in ovarian reserve. And then finally, you begin to get these irregular cycle, non-ovulatory, and then finally you get to menopause. Again, this is just me talking about nature. This is what we know as a reproductive endocrinologist, biologist, gynecologist. We know that these are the facts that we deal with. And of course, in the area of fertility, the issue is egg in most of the time. So what are we talking about when we say a follicle or an egg? What happens? Well, all of this early development, and this is like a 3-month pathway for an egg to be called into action until it reaches the time it can ovulate, is about 90 days. So of course, during those 90 days is the time for you to do healthy body, fertile body, adjust your diet, reduce your carbs, do some fasting, take all the nutraceuticals, avoid alcohol, tobacco, drugs, all of these things you can do during that your life, but of course during that 90-day period prior to the month where we're going to get the eggs out. So here you just see a nice picture of the different types of follicles, the early follicular. This is the antral follicle count, is what we counted these little circles, in the beginning of the menstrual cycle. So this is the antral follicles that we count. And then, of course, they grow, get bigger, and ovulate, and usually based on a trigger. And that trigger is around, the body's trigger is around 18, 19 millimeters in mean diameter. So in IVF, we're always measuring your follicles to wait till they get 16, 17, 18, 19, because those are the follicles that we know will have a mature egg. So this is what happens inside the follicle, and this is what we deal with when we do IVF, when we do IUIs, when you do a natural cycle, is we want to understand how time plays a role. So time plays a role in the number of eggs. Time plays a role in how those eggs develop. So again, the theme tonight is persistence plus perseverance equals pregnancy. Well, both persistence and perseverance are really a time phenomenon, continuing to do something to achieve a pregnancy. So here's the story why we talk about age so much when we're talking to patients, and it's because we understand this biology. Now, hi Michelle, jump over to Facebook, Michelle 8297, and come to Facebook or YouTube to see this lecture, and then I can answer some questions over there. Thank you. So here you see that around 14, 15, you have 400,000 eggs. But from around 18 to around 35, Gosden studied specimens of ovaries from women from before birth, in other words, miscarriages, all the way up to 80 years old, and counted the eggs. And what we found is a calculation that prior to age 35, that magic bend there, women lose about 1,000 eggs a month. After age 35, this is that divergence in this pathway, we start losing about 10,000 eggs a month. So there actually is a description that over 35, we consider that advanced maternal age for things like risks for miscarriage, or risk for Downs, etc. But also for us as reproductive endocrinologists, that's kind of a break point for us for pregnancy rates. Pregnancy rates are kind of pretty flat until we get to about 34, 35. But boy, after that, every 2 or 3 years it goes down, then every year it goes down, then every month, then every week, you'll see this dramatic loss in the number of eggs a woman has. So again, it's a function of time. So what does this mean? Well, again, now we'll talk. Now, just again, I'm jumping all over, just talking about time. Does sex on which day of the cycle matter when it comes to pregnancy? Well, here's the day of ovulation, and so they studied a group of folks, and these folks had sex 5 days before ovulation, 4 days, 3 days before ovulation, 2 days before ovulation, 1 day before ovulation, and on the day of ovulation. And they looked at the chance of conceiving based on when you had sex. Well, I guess it's obvious that anywhere between 2 days before ovulation to the day of ovulation, that's your sweet spot for getting pregnant. So when I talk to my folks about how do I know when to have sex, or should I have sex every day? Not necessarily. That's a male issue, and we're not talking about males today. But if we have intercourse twice per week, separated by 2 or 3 days, you'll never miss the optimal time of conceiving. So, and the reason for that is, as you can see, the ovulation, you have a 2-day window here, right? Well, sperm can live about 4 days inside the vaginal tract. So if you have sex twice in a week, it's almost impossible to miss the window. So throw away those sticks, mucus tests, honey come home, oh my God. So, if you can have intercourse every 2 or 3 days, not every other day, sorry, you want to have intercourse and then separated by two days. So I miswrote that. So here's another denominator where timing matters. So here's where timing matters. And then, of course, this is our beautiful image of the ovary. And I think it's worth looking at just for you guys. So this is the stalk. Now, the stalk to the ovary is connected to the mesosalpinx, or the side of the uterus. And that's where all the blood vessels come in. And then these are showing you the various stage of follicular development, which I already showed you. So again, this is a time phenomena in a menstrual cycle. And so these antral follicles are what we measure. Now, an antral follicle is just a little space. Now, it's made to look really detailed here, but in reality, because it's a cartoon, but it's just a little space. These have to develop to a mature follicle. So this might be 10 millimeters. This would be 20 millimeters. For this follicle, it's just showing you time phenomenon here. This is not all of them happening simultaneously. Now, once ovulation occurs, these estrogen-producing cells change to produce progesterone. This is the corpus luteum. This is what feeds the pregnancy for the first 8 weeks of the gestation. So this cycle of the ovary is all time dependent, okay? But this is where all the action is. So what's the effect of age on the monthly pregnancy rates? So if you're in that sweet spot between up to age 24, you have about a 25% chance of achieving a pregnancy each month with intercourse. But as you can see, just simply the age of the female as she ages, and now you know it's because of the loss of eggs, because of the age of the eggs, and because we don't make eggs, we just use eggs throughout our lifetime. We see this gradual, then much more rapid loss in pregnancy rates. Again, this is nature. There's no magic to this. This is just nature. Nothing is going to change this because this is genetically determined by your mom and dad's X chromosome, mostly your mom's X chromosome. So this is the phenomenon that, these folks, they can take their time to get pregnant. Of course, these folks, we want them to be more aggressive, meaning they're over 40. So we want to do as much as we can to capture those eggs. So I thought this was interesting. This was a study looking at, well, what about your income? Does making a certain amount of money impact the when you have your first child? And again, some of these are kind of interesting. Well, it shows that in a normal, this is the base population making less than 100,000 a year. But the wealthier you are, or the more, I guess, you're a professional, you are, you can see that it's not as abrupt the curve. It actually stretches out. So, where some women who are making less than 100,000 are beginning to have children, at 15, or even here at 13, 14, 15. You don't tend to see that from wealthier families. And here they peak at around 19, 20, and then there's fewer and fewer women who don't make that amount of money. But here you see that it pushes it to an older woman. Well, probably because to make that kind of money, you're spending more time in college, more time in graduate school, more time at work. So I thought that was an interesting thing that we don't think about. Similarly, about education, the time of the first child averages around 19 in a no college person, but in a college person, it's around 27. And we've already talked about the fact that, 19, here's a pregnancy rate, 27, it's down a little bit, not a lot, but it's just there. So I thought that was interesting. Now this was interesting, vocabulary score. And so in other words, you use a lot of words, and again, it's a surrogate. To me, it's a surrogate for education and higher education. As you can see, the better your vocabulary. And again, I'm doing this to show you so many factors that can reflect pregnancies. But here you see that as these patients were tested, their vocabulary scores, this is kind of those college age anyway. So the bottom line is just another way of saying there are many factors that affect when you have your first child, other than choice. Now, one healthy baby, right? We want, they call it relative hazard. That's a statistical term, your chance of getting pregnant. If we use up to age 33 as the standard, you can see that as you get older, if you just look at pregnancy rates, they seem to be high right here, but we want babies. So in reality, it's not just about pregnancies, it's about live birth. So when people talk about, I want to get pregnant, they're really talking about a live birth. And so we as physicians are always thinking about live birth. That's what we're thinking about. I know the pregnancy is important, but getting you to the finish line is the most important thing that we have to consider. So there's actually differences. So you may hear a pregnancy rate here, but it's not really a live birth rate. So we're looking at live birth rates. Again, time phenomenon. So what about in IVF, getting eggs? So again, I'm teaching you about, and the reason I'm showing you how time impacts it is that you need to be persistent and persevere to get pregnant. So on average, when we do IVF, you get about 30 eggs from a 30-year-old, but watch, just simply, this is per egg retrieval, right? As you get to 35, you're down to 12. We get to 40, you're down to about 9. You get to 45, you're down to about 4. Hey, Kelly, I'm going to answer questions after I do the lecture, so keep your questions sort of in the back of your mind, and I'll get back to them, okay? But I'm going to finish up this talk first, and then I'll answer any questions you have. So as you can see, eggs are also a function of time, as you know. And then I thought this was very interesting, the number of mature eggs and the probability of having at least one live birth. So of course, as a donor, you have, the more eggs you have, you're almost at 100% if you can get 25 eggs. But look how many eggs you have to get, let's use 80, this says in a donor. So in a donor, to get an 80% chance of one live birth, you need to get probably around 15 eggs. But if you're 40 years old, or let's say 39 years old, you need at least 40 eggs to get a live birth. And if you're 42 years old, you need around 100 eggs. Now, of course, that sounds extraordinary, but statistically speaking, the purpose of this slide that I'm presenting to you, it was a discussion of the mini IVF and egg freezing, but the real thing I liked about this is to get us to a realistic expectation of what's it going to take for us to achieve a pregnancy in terms of numbers of retrievals. So, for example, a donor can easily get 20 eggs on one retrieval, whereas a 40-year-old female, it might take her 4 retrievals to get, or let's say 3 retrievals to get 20 eggs. And a 44-year-old, it might take her, 5 or 6 retrievals to get 20 eggs. So, and it is the number of eggs that determines success. So what do we mean by egg quality then? So we talk about egg quality. So here's an interesting way of looking at egg quality. Because Karanita, 77, New Mexico, jump on Facebook Live. Everybody who's on Instagram, jump on Facebook Live. I have about 10 more minutes on this little lecture, and then I'll answer all your questions. So jump on CNY Fertility Facebook Live or YouTube channel, CNY Fertility. So when we talk about what do we mean by egg quality, this is a very crude but very honest way of looking at an egg. 23 chromosomes are what you're supposed to have in an egg. If you have 22, not a good chance for success. If you have 24, and this happens as we age, that 23, we get more and more of the 22s and more of the 24s, etc. So when we look at egg quality, we can only see how it functions unless you do PGTA. And if you do PGTA, we can only look at the embryo's quality. But to think about what happens with age is that we get fewer eggs, but the quality also goes down as we age. So there's a time function. That's where we have to be persistent, do a second cycle, do batching. It's because of our biologies that we are not moving forward any further than our biologies can. We have a certain limit to biology. Now, there's a question on Instagram, which is actually interesting. Why hasn't science advanced to understand about implantation? Because we are not allowed, nor any country in the world is allowed, to study human reproduction with humans. We're not allowed to get 50 women pregnant and see what happens with the same, sperm and egg. And, we're not allowed to do those experiments. We're not allowed to study what happens when a mature egg implants into the uterus. We're not allowed to study it. So if you can't study it, now what I'm hoping with the new administration, we're going to begin to be able to study these things. But up until this point, since Ronald Reagan, we've not been able to study it, nor has many other countries. That's an aside. So that's, again, jump over, Shoni, to Facebook Live, and you'll see this lecture. So what's the relationship between age and egg quality? Well, the average number of embryos that are genetically normal based on the female's egg, which again, surrogate endpoint for making a baby, you'll notice that a 26-year-old, about 70%, 75% of her embryos are genetically normal. At 30, that's about 65%. But by age 40, it's about 30%. And by 42, it's about 10%, 15%. So the person who's 42 would have to do many more cycles to achieve a pregnancy than a person who is 20. And it's mainly because it's a function of numbers of eggs, quality of eggs, and its likelihood of implantation. So always, and part of CNY's philosophy of creating high quality, affordable fertility care is the fact that every IVF practice in the world knows these slides. So every single one of them knows that they're not going to change your biology. We can't change your biology. We have to deal with it. So pretty much, even in the best of circumstances, most folks take 2 IVF cycles to make a baby in their 20s, take 3 to 4 IVF cycles to make a baby in their 30s, and take 4 or 5 IVF cycles to make a baby in their 40s. We all know this. This is based on our biology. But what CNY fertility has recognized is who the heck can do 4 IVF cycles at $25,000 to $40,000 a cycle? Who can do that? So that's why Dr. Kiltz, myself, Dr. Magarelli, we created this high quality, affordable model where we allow folks, and again, it's not inexpensive, but relatively inexpensively, to do at least 2 or 3 cycles based on our biology. So you can see that egg quality is also dependent on time. So here's an example. And this is something I think every one of us needs to, that's why persistence and perseverance is so important. If you look at this slide, it's a 32-year-old patient. She got the average 15 eggs that she was supposed to grow, 15 follicles, I should say, grow. Of those 15 follicles, they retrieved 12 eggs, which is darn good. That means 75% of the follicles we got eggs, but that's a 25% loss in the number of follicles to eggs. Then of those eggs, she got 9 to fertilize. That's great. That's a really good number. However, because that's 70%, which is what we want, but that means she lost an additional 30% of her eggs. Then to get those eggs to develop into an embryo, they went from 9 fertilized eggs to about 4 embryos. That's another 60% loss. And of those 4 embryos, only 2 of them were chromosomally normal. That's another 50% loss. And then of those, only 1 implanted, which is another 25% loss, and then had a baby. Okay? So this biology, this actual biology is why we encourage folks, think about doing more than 1 cycle, budget for more than 1 cycle. You know, we try to keep our fees as low as possible so you can do more than 1 cycle. Healthy body, fertile body. You know, all of this assumes no alcohol, no tobacco, no drugs. This assumes, you know, the keto. It assumes, you know, healthy lifestyles. Why? Because those make these numbers worse. They don't make these numbers better. So if you look, then remember I said we're not just about pregnancy, we're about live birth. Pregnancy does not equal live birth. So here you see the chance of a live birth based on the quality of the embryo. And what you'll notice is that no matter whether they're good, fair, or poor, you lose about 10% of most pregnancies will miscarry before a live birth. And so the other point of this slide, which I really want you to pay attention to, is many folks are, oh, what's the grade? What's the grade? What's the grade? What's the grade? How pretty are my embryos? How pretty are, thinking that's a measure of egg quality or embryo quality. But here you see that regardless of the embryos you transfer, the loss rate between pregnancy and live birth is the same because the embryo is an all or none cell. It either works or doesn't. Now you do see, though, that there is a decrease of about 7% and then 4% in terms of overall pregnancies and overall live births. So, you know, there is some merit to it, but it's not lockstep. But again, my goal here is to show you that pregnancies do not equal live births. Now, can IVF save the day? Well, if you look at this slide, we're showing you the pregnancy rates, the natural pregnancy rates for women using their own eggs. You know, and by the way, this is based every single IVF center in the country. So they all every year have the same results, but every year you will notice on websites everyone's improving. But for the past 15 years, if you accumulate all the IVF in the United States, which by law we have to do, there is no changes. There are no changes. So if there are no changes, but your website is saying there's a change, you might be suspect about that. But here are the numbers of the pregnancy rate in sort of this tan color. But of course, what's an alternative? You use younger eggs. So that's a donor egg. Just showing you that that can, quote, save the day, but it may not be what you want, but it is an alternative. And then the number of cycles you can expect to do to achieve a baby is based on your age. So to get 70%, let's say to get 50% of the folks pregnant, this is a UK study, if you were less than 40, well, actually 35 is probably a better number, 40 is a little too broad, you had do 2 cycles, you had a 50% chance or more of getting a baby. By age 40 and above, you had to do actually well more than 9 cycles to get 50% of those folks pregnant. And at 42, well over probably 10 or 15 cycles. Again, persistence and perseverance. They got it. And again, the person in front of you has a 0 or 100% chance of pregnancy, but it does depend on time, your age. And here, this is cumulative pregnancy rates. It's a little bit harder slide to read. This is basically saying in a fresh cycle, as the woman ages, these are the number of patients or number of cumulative pregnancy rates over time. You can see that in the fresh, of course, it goes down, but if you add the frozen embryo transfers, the cumulative pregnancy rate goes up. But again, you'll notice that the slopes are very different as you get older. So, oops, that's my summary. I think this is a better summary. Anyway, so persistence plus perseverance equals pregnancy. Everybody has a 0 or 100% chance. The younger you are, the fewer the IVF cycles. The older you are, the more IVF cycles you need to be persistent to achieve a pregnancy using your own egg. So, okay. All righty, let me take a sip of water and then let the questions begin. Hi, Mrs. Giffen. How are you doing? You did your transfer yesterday? Yoo-hoo! Good luck. We're going to say a prayer. Everybody say your prayers for Mrs. Giffen. All right. Oh, on both sides. Okay. Gabriella, that's right. I named your embryo Gabriella. Okay, so Amy, there's hope for having a live birth and natural pregnancy at 35 with PCOS. Absolutely. My AMH was good. Again, eggs tell the story. What might cause no eggs to be retrieved during a retrieval, Kelly? My AMH is 5, so you have eggs. You triggered E2 rose to 420 at the highest. Well, Kelly, it may have been that you needed more time. You may have needed more time to stimulate follicle growth, like an extra day or two. So look at the number of days you were stimulated. Look at the slope. The doctor can do this, the slope of the line, and see maybe an extra day. Reiki, with current implants, can immune protocol without LDN still reduce enough inflammation? Absolutely. Each one of the components in the CNY fertility family of immune protocols for the management of fertility, all of those are incremental, and some of them are synergistic to helping you reduce inflammation, improve implantation, and a live birth. Yazzie, better fresh or frozen? Everyone asks that question every single week. The answer is it depends. Depends on your history, on your estrogen level. If you have ovarian hyperstimulation, depends on a lot of things. Oh, you're welcome, Amy. Hi, I'm new and will start my first cycle next month, if not March. I am 34 and would like to know my chances of a success. Ebony. Well, hello, Ebony. It's your first cycle. There must be a reason you're doing IVF. Let's say the reason is sperm only. At 34, if you're doing a basic IVF cycle, you have about a 30% chance of success. That's about 25 to 30% without testing the embryos. If you test the embryos and you get 2 chromosomally normal embryos, then you're closer to a 50% chance. Journey to baby. I missed the first part of your question. I apologize. Does Colorado do donor eggs? Yes, we have them available. Do we do IVF in Atlanta? No, we do not. I can't tell you if that's going to happen soon or not. We want to share our eggs to cover our costs, and she was accepted as a donor somewhere else, but we aren't having lots of luck matching on our own. Do you have a similar program? You know, I would contact CNY and talk to the donor program, Elizabeth. They know more about that. I've had an ectopic, and I have 1 tube, forgot to mention. This is Ebony. Yeah, again, with IVF, Ebony, your tubes don't matter at all. What circumstances do you suggest embryo testing? Well, if you have recurrent pregnancy loss, if you're over 40 and you make lots of eggs, if you've had failed IVF with untested eggs, you might want to find out whether or not the egg and sperm are complementary. But not a lot of other reasons. We used to think they were good for everybody, but no, it's not. Do we plan on working with the clinic in Toronto? Do you plan? Oh yeah, Dr. Fayez, if that's who you're talking about, I think he's in Quebec. He's in Montreal. I'll work with anybody. CNY works with everybody. Did these stats factor in those that retrieved eggs at a younger age? Well, each one of these are different studies. You know, the stuff that I'm giving you are from many, many different studies, and it's really to give you a flavor of how time plays a role, age plays a role, eggs play a role, nature plays a role. That is out of our hands, and so I'm trying to get us to feel a little bit more comfortable. I've commented above, but I think it was missed. I'm 31, AMH of 4, hubby is 30. However, I have a balanced translocation. Do you find good AMH helps out with, oh no. Okay, translocation is a chromosomal abnormality, which allows a woman or a man to be normal, but their offspring, embryos, may have a detrimental translocation, so development doesn't happen. AMH has nothing to do with it. So what you want to do is do pre-implantation genetic testing, look at the embryos. My very first PGT-A, it's actually called PGT-SR, study was with a translocation couple, and this family had a family history of all the males having problems with fertility in their partners, and we found out that it was transferred to the embryos. We found the 2 normal embryos had a son. That son doesn't have that translocation, so AMH is not available. When are you available for consultation? I seem very nice. Thank you, Bird Bash. Basically, there's an 800 number, CNY, go to cnyfertility.com and just make an appointment. Get in. I think it's maybe 2 or 3 months. May you repeat, the office in Atlanta can do it? Cannot. Gabriella, the office in Atlanta cannot do retrievals, but they can monitor. Pinky, I just finished my first cycle doing IVF, had four great follicles. How do you know that? According to someone told me, when I did my retrieval, only 2 eggs. Perfect. 4, 2, and you're 43. You're fantastic. That's what this whole purpose of this discussion was, is that it takes time and repeated effort, time and repeated effort for us to basically achieve a pregnancy. So this is a loaded question. Are there studies or statistics that prove that your chances of having a live birth increase after miscarriage? My wife just turned 36. We had 10 follicles, 7 eggs. What do you suggest for improving egg quality? Sabrina. So, healthy body is a fertile body. No alcohol, no tobacco, no street drugs. Go to CNY Fertility. Download our family building guide. Look at the medications. Look at the diet, the keto diet, the intermittent fasting, reducing carbohydrates, acupuncture, acupuncture, acupuncture. Go to www.aborm.org, aborm.org. These are board-certified fertility acupuncturists trained by Dr. Credenda, East Winds Acupuncture, Colorado Springs, trained by me, Dr. Paul Magarelli, CNY Fertility. We created this Credenda Magarelli acupuncture protocol, as many other people have done in terms of research. It works, it helps, try it. Why is Colorado starting us till March? Well, that's not far. I mean, why is a hard question, because we're busy, I guess. Well, the chart shows 15 follicles, then lost to 12, then lost again, but the success rate of the frozen eggs being successfully fertilized is 75%. That's higher than going through the entire harvest. No, it's incrementally lost. Incrementally lost, Elizabeth. Look at the numbers, not the percentages, okay? Look at the numbers left over. My first appointment with you, do I need to do to possibly get a better chance with you? Pinky, no, Pinky, just fill out the forms online. Make sure you fill in all the information about the testing you've done. By the way, folks, you can get all your testing done before your very first visit. Just contact us, make an appointment, ask if you can get your testing done. Eggs, sperm, uterus, blood work. Get it done before my first visit. And guess what? That first visit with any of the docs at CNY absolutely will accelerate you jumping into a cycle. What is jumping into a cycle? It's you meet us, it's probably 6 to 8 weeks before you get into a cycle. Just do the math. It's just impossible the very first month. That's paperwork and blood work and testing. Second month, ordering medications, education, and then there's your 8 weeks. So that's what that's about. What do I think, Shannon? That's a repetitive word. What do I think of the ERA test? I think it's like all tests. They have a role in our understanding of fertility. If you have failed implantation from IVF, especially chromosomally normal embryos, I would definitely look at the ERA as a way of understanding why is it I'm not getting pregnant when I have a chromosomally normal embryo and everything else is okay. So that's something you can do. Is Lovenox and Neupogen is done during stims or transfer? Today is my baseline day. Strong mommy 2B. Well, there's a protocol, so you will get all of that written down. So when you talk, if it's your baseline right now, you should be on it. If you're starting your baseline, you should be on it. Similar to another question, why would no eggs be retrieved from follicles? Aren't there eggs in all follicles? No. Only about 70% of follicles will have an egg, as you can see from that studies that have been done, and that's been my experience. Depending on the age of the woman, that can go down to 25% of follicles having eggs. That's number one. Number two, timing is critical, and you can't know that until you try. So if you tried once and it turns out you didn't get eggs, we might want to change the protocol, spend more time gestating or cooking the eggs in your oven, and then taking them out. You might do a double trigger. At CNY Fertility, we do double triggers routinely because we kind of feel, why not give you the benefit of 2 triggers, which work by different mechanisms, so that if it doesn't work with HCG, it may work with Lupron. All right, where am I? I think I lost a bunch of these things. Okay. When would you typically have implantation symptoms for a day 3 transfer? About a week after transfer, but you're never going to have symptoms. Don't worry about it, the symptoms. Worry about the pregnancy test. You'll go crazy. Oh, is this a symptom? Is that a symptom? 9 days later, do a pregnancy test, read the number. That number is going to tell you what. Now, I know that's the craziest 2 weeks of your life, but to be, because some people have symptoms and they're not pregnant. Some people have no symptoms and they are pregnant. It's not very indicative. Belair House, nursing donor right, nursing done right at Gmail. Can you send those slides to me? Are you talking about the COVID slides, Belair? So contact us, at the info@cnyfertility.com with your information. I can't do it through here. And tell me specifically what you're looking for, say Dr. Magarelli live, etc. Deepak, I hope this is working here. Good. Deepak, let's see, 29 years old, unexplained, got pregnant with 4th IUI. Unfortunately, was an ectopic, treated with methotrexate. Okay. When is it healthy to try again? 2 months. Is IUI worth a try? Deepak, you just got pregnant. You just got pregnant. So sure, of course. With keto, I have tried it twice and had kidney stones. Primary care says no more keto, which I hate because my husband has lost 129 pounds. That is, wow. Any suggestions? Absolutely, Amber. Mediterranean, the Mediterranean is a wonderful approach, different than the keto, and then count calories. 32 years old, first cycle. What is my percentage of success without PGT testing? This is Kaylin. Well, really, Kaylin, the chance is 0 or 100 for you. And then in the population of normal 32-year-olds with no major egg issues and no uterine issues, it's about 30%. It's about 30%. Have you done keto guided by a doctor? That's Martha helping Amber. Yeah, so Martha, that's a good idea. Elizabeth, is ERA as helpful if you have not failed? Well, that's not a question you can answer. If you are doing natural transfer, is ERA still relevant? No. No, because the purpose of the ERA is to accurately predict based on progesterone supplementation. So no, natural cycles, that doesn't fit. Journey to Babe. I developed a fever after my second COVID shot for about 24 hours. We started Sims. Will this affect quality? Nope. Sorry, there's no data to say that that's going to affect the quality of your eggs, because your eggs were in your body since before you were born. Bird Bash at 44, AMH is 1.4, 10 eggs. Wow. How many egg retrievals do you think we need to do to get a good embryo? And have you worked for? Yes, of course, we work with women up to age 50, 52. You'll probably have to do 3 or 4, at least 4 probably, good retrievals to find one chromosomally normal embryo. I don't have an opinion on Pixie. I don't. Shiri Cola. That's an embryologist world. I've been doing ICSI since 1986, and it works remarkably well. Ray Lynn, I'm 32, had 2 failed IUI, diagnosed with left UU. Mm-hmm. Don't know what that is. Sorry. Mini IVF, who's a candidate versus standard? It depends on your history, but usually if you're older than 40, I would think about, or 42, I would think about a mini. 32 at 2 failed. Do you know any success with IVF and UU patients? I don't know what that is. Grace Lee, is 3% normal morphology on my husband's semen affecting IVF this week? Grace, no, because quite frankly, ICSI will get around that. My question keeps getting missed. My AMH is 3.45, and my egg retrieval was 2. I don't know why I had just 2 eggs. How many follicles did you have, sweet McBeal? Strong mommy to be. I would trust what the nurse says about the Neupogen and Lovenox. They're really associated with transfers, but the longer you tend to be on some of these medications, yes, Neupogen and Lovenox are for, well, Lovenox is for transfers typically. Neupogen, you can use probably both, but the Lovenox for sure is for transfers. Sassy Southern Gal, if no dominant follicle for a natural FET, should I cancel and try next cycle or transition to medicated? Sassy, if you don't know anything about this doctor believes that the reason we're coming to me is not to do nature anything. It's to adjust and control and shift and manage and improve and synergize by the use of medications. That's what we do. Anytime you get away from that, your pregnancy rates go back to as low as they were without help. It's essentially saying, I don't want help, but I want to get pregnant. And I know that's probably contradictory to a lot of people's. And again, we will help you whether it's natural or not. But again, I use science to help you. Amy, my uterus, no, this is Raylan, is tilted to the left side. I only have my left tube. I don't know what the question is. If you have a 0.8 AMH, is it still possible to have successful IVF? Abby, absolutely. On cycle day, is transfer done in, okay, Judith, you'll have to get a little bit more information there. I just read great advice. Any changes? Oh boy, this is not working. What's going on here? Oh, I was in the way, sorry. I had a canceled cycle because of positive COVID test 2 weeks ago. After getting my period today, I had my baseline done showing I still have 6 follicles that are 20, but the nurse still wants me to start meds Thursday. Is that too soon? What will happen to those large follicles? They'll ovulate and go away. I think I did a short talk on cancer fertility. It turns out that any time in the menstrual cycle, you're able to stimulate eggs. Now, again, I don't know your whole story why we wouldn't wait for those follicles to resorb. You might ask that question, why wouldn't I wait for those follicles to resorb? Okay, strong mom, you're very welcome. Going back to study. Okay, strong mommy to be, go back to study. By the way, folks, if you guys want when you talk to me to be on Zoom, right now we're not doing Zoom meetings because it got too hairy, but I love Zoom meetings because I get to see you. So if you set up a new patient appointment, just say, we would like to have a Zoom, if that's possible. And they'll set it up. And then when I get on, I'll say on the phone, I'll say, hey, here's my Zoom number, rock and roll. So be ready. Anyone who wants to do that. And I think next month we're going to have a different model, but try that. Okay, boy, I so wish we could do Zoom. Amber, you can. Amber, you can do Zoom. Just ask for it, and especially if you're talking to me. Not with any of the other docs, just me or Amy Jenkins, my nurse practitioner, or Dr. Skosnick. You can ask for Zoom. We love it. I was just wondering if you have ever worked with unicorn. Oh, there it is, the UU. Yes, of course. UU, unicorn uterus. Got it. So yes, we have. It is what I'm specialty trained for. They gave me a Zoom link. Great. Can you do ERA during the same cycle you're doing an antimicrobial protocol in preparation for transfer? Absolutely. Have you ever used Lupron flush to lower FSH prior to stim? Judy Gallant. You cannot lower FSH. So we've talked about FSH, we've talked about AMH. They're just gas gauges. So your number is your number, your eggs are your eggs. And again, my whole presentation today showed you that that's based on your biology. And by the way, the presentation will be on YouTube, it will be on Facebook. So if you want to review it. Okay. All righty. I think either I've slowed down or something slowed down here, or I'm not getting any more questions. Oh, I was encouraged to read It Starts with the Egg, and I'm finding it super. Yeah, It Starts with the Egg is a great basic thought about nutrition and its role in nutraceuticals. As a cancer survivor after chemo, would I ever have a chance to become a mom? I did 1 egg retrieval, 2 eggs, 1 retrieved, 1 fertilized. Well, you've proven that you have a chance, Maddie, Georgie. So yes, absolutely. Can you provide the website for acupuncture specialists again? Yes. The American Board of Oriental Reproductive Medicine, www.aborm.org, and great folks, but mention my name, mention Dr. Credendo. What office am I in? I'm Dr. Paul Magarelli, CNY Fertility, Colorado. But of course, I talk to people all over the country and all over the world. Coco is saying every time I call you guys, I can never get through. No, you can always get through, but it is a half an hour to an hour wait on our phones. We're getting about 2,000 phone calls a day and 20,000 requests for care a month. So it's critical to understand we are doing the best we can. We have over 390 employees and 44 people on the phone. But really, don't try the phone. Forget the phone. Use the portal. The portal is the only thing that's documentable. So it's critical to use the portal. And if you don't know how to use the portal, stay on the phone until you find somebody. Okay. Then say, how do I use the portal? But the portal today in medicine is really the only way to do it. Shanzerez with ZZ, Shanzer easier to follow and understand. I wish you were in New York. I'm a New Yorker. No, that's what I grew up as, a New Yorker, but I'm in Colorado. How many IVF cycles do you recommend for a woman who's 37 years old? As many as it takes to get pregnant. I'm in Toronto. Unfortunately, the borders are closed. My egg, okay. I wish you could fly, Maddie. It'll be soon. Give us another 12 hours in America will change quite dramatically in the next 12 hours. Let's see. So for me, I'm 35, Tasha. I only have 1 ovary. Did my first IVF in 2016 when I was 31. 2 eggs. I got 1 and have a 4-year-old. Yay. Do you think it's going to be harder? Absolutely, Tasha, because you're losing 1,000 eggs a month. I already started keto and have been taking CoQ10. Fantastic. Oh, well, Tasha, you can ask if you specifically want to talk to Dr. Magarelli. You can ask. It's just it goes on my schedule. How many donor eggs you need to get a live birth? Usually 12. We get, because nothing is perfect, for each 6 eggs, you can expect 1 pregnancy. That's why they give you 6. That's why they sell 6 eggs. What cycle day are transfers done? I miscarried in November. Not sure what your question is. They're done exactly when they're programmed, so there's no specific. Um, you have that's based on your medications. There's no cycle day per se. We create that cycle day. Does Gonal-f and Menopur absorb better in the arm rather than the butt, especially if higher BMI? Absolutely, Caitlin. For my high BMI patients, I always recommend the deltoid. And that, by the way, you notice that's where they gave you your COVID shot, is in the deltoid, because beautiful muscle, there's no fat there, easy to get to, safe, there's no big vessels. Your arms are always moving, so good blood flow, excellent blood flow. So I know some of you don't like to get intramuscular shots up there and rather it in the butt, but if you have high BMI, then heck, man, you're spending all that money. Do it in the arm. You'll probably end up saving money. I'm 39, doing my first IVF cycle. I'm just starting Q. Is it too late to be starting? No, gosh, no. This is Christy. I got to stop here, but the approach to keto is to reduce the sugars. Reducing the sugars in your system, any kind of sugars, juices, fruits, reduces the insulin secretion. Reducing the insulin secretion allows your body to get back to its natural fertility base. So a keto-oriented way of eating, the kills keto, everything is oriented towards lowering the insulin in your bloodstream, because the insulin can interfere with so many processes of fertility. So that's the deal. So if you start today, you're benefited today. So it's not a time, that's not a time thing. Get started as soon as you can. Okay. Okay, so where are we? Okay, so Menopur for HCG for stims. I'm 42. Oh, versus HCG LH. Kuamo Duamong. Either one works fine. I keep looking at it. They work fine. You'll save about $1,000 if you substitute HCG LH for the Menopur. You'll save between $1,000 and $1,500, which I always want you to do. I want you to save some money. So all you folks on Instagram, please jump over, start learning how to use the Facebook Live and YouTube live streams so that I can do lectures for you guys, and put information up there so you can see it, and then you can save it, and then you can review it. I know you love jumping on. I don't use Instagram, so I don't know why you love jumping on Instagram. Maybe it's nice, but the bottom line is, for all of you, we want to make a unified place for all of these amazing lectures that we do, and we did like 8 or 10 of them a week. So they're all going to be funneled into a YouTube channel. They're always going to be on Facebook Live, but for some reason Instagram won't let us do it simultaneously, nor will they let us do PowerPoints. So anyway, so the bottom line is, as usual, an hour has flown by. And I adore this. I mean, I was so excited to do this talk, because it really helped me better understand numbers. And these numbers, I hope, will help you understand that, guess what? You're not alone. Everybody's a human. We're all human. We're working as hard as we can. And so be persistent. By the way, be persistent with us. Get on the phone, stay on the phone until you get an answer. Persevere. If you fail once, it doesn't mean you're going to fail again. That's how we get to pregnancy. And we're here for you. So kisses to everybody. I really appreciate it. You guys know how much I love those kisses. And I don't know what I'm going to do next week. I haven't decided. I kind of go at the spur of the moment that I'm working on. I'm teaching at Yosan University now, a bunch of wonderful doctoral students. My wife, Dr. Diane Credenda, has just added a new doc. I'm adding another doc in actually the end of this month, starting February, so that's going to help. You all are amazing. You all are amazing. Remember, nature wants you pregnant. It actually demands it demands you get pregnant, okay? So that's what nature wants you to do. So you're not fighting nature. We just got to figure out how to navigate this. How do we navigate getting you to a baby? And we'll try as best we can. So folks, have a great evening. This is Paul Magarelli, CNY Fertility. I love seeing you guys every week. I love the people who come back. I love the kisses. And you guys be well, be safe. I do strongly recommend the COVID vaccine for everyone. So have a wonderful day, everybody. Bye-bye.